Sanders for his opening statement.
Thank you, Mr. Chairman, and Mr. Secretary, thanks for being with us. Let me begin by quoting a sentence that came from your prepared remarks. You state, and I quote, "The United States remains the sickest developed nation, and we spend $4.5 trillion annually on health care, 2 to 3 times more per capita than comparable nations. Clearly, something is structurally wrong with our approach," end of quote. You're right. The current healthcare system is broken. It is wildly expensive. It is dysfunctional. So what do we do, Mr. Secretary, to address it? Maybe for a start, we do what every other major country on earth does and recognize that healthcare is a human right guaranteed to every man, woman, and child. Maybe we understand that the function of a rational healthcare system is not to make hundreds of billions of dollars in profit for insurance companies and drug companies who often engage in stock buybacks, pay their CEOs outrageous compensation packages. There was a guy from one of the major drug companies sitting exactly where you are sitting last year. A guy makes $50 million a year. Meanwhile, we don't have enough doctors, we don't have enough nurses, we don't have enough dentists, we don't have enough pharmacists, we don't have enough healthcare workers in general. You are right. The system is structurally broken. We spend far more, we have a shorter life expectancy than other countries. So this is an issue that I want to address with you. How, in fact, do we guarantee health care to all people and do it in an effective way? Let me say a word about prescription drugs. You and President Trump had a press conference earlier this week discussing an executive order that both of you claimed would make sure that the American people pay the lowest prices in the world for prescription drugs, not the highest. As you mentioned at your press conference, this is a concept that I personally strongly support, and I think you are aware of that. But as President Trump and you should know, this executive order, like Trump's previous executive orders on the subject, will likely be thrown out by the courts, and we will be back to exactly where we are today, paying by far the highest prices in the world for prescription drugs. In my view, the way forward is through legislative action. So, if you and President Trump are serious about significantly lowering the outrageous price of prescription drugs in this country, as I hope you are, I would very much appreciate both of you working with me and other people on this committee and in the Senate on legislation that I will soon be introducing, which accomplishes exactly the same goal as you and the President talked about, making sure that we pay no more for prescription drugs than people in other major countries. So if we are serious about that, let's work together and let's make that happen. And in fact, if Republicans and Democrats come together on this, if we prioritize it, we can pass that legislation in a couple of weeks. Thirdly, Secretary Kennedy, all of us want to make the government more efficient and cost-effective, and few would deny that there is too much bureaucracy. But let me tell you also what we want and what the American people want. And that is, we want the federal government to play a major role in continuing its efforts to combat such terrible diseases as cancer, Alzheimer's, diabetes, heart disease, and other terrible illnesses that claim the lives of millions of Americans. In that regard, I must tell you that I have heard from citizens, patients, and doctors in Vermont and all over this country who are deeply concerned that under the leadership of you and Mr. Musk, the Trump administration has terminated at least $13.5 billion in health care funding, including more than 1,600 grants to conduct vital research into cancer prevention, Alzheimer's, diabetes, and cardiovascular disease, among many other medical research investments. In the first 3 months of this year, the National Institute of Health has been effectively cut by $2.7 billion, a 35% cut, reversing over a decade of investment in medical research. Under your leadership, cancer research has been slashed by 31%. Further, Secretary Kennedy, under your leadership, you have undermined the vital role vaccines play in preventing disease during the single largest measles outbreak in 25 years, which has led to over 1,000 cases of measles, over 125 hospitalizations, and 3 deaths. And let me say a word about USAID. Elon Musk, the richest man on earth, who has led the effort to cut health and nutrition programs for the poorest people on earth, has absurdly suggested that no one, quote unquote, no one, has died from the massive cuts to USAID. Mr. Musk is 100% wrong. According to independent researchers, nearly 200,000 people have already died throughout the world as a result of the massive cuts in funding to prevent malaria, tuberculosis, HIV, malnutrition, and other serious diseases. Further, as a result of the elimination of U.S. funding for a global vaccine program, it has been estimated that over 1 million children will die because of the cuts that will save taxpayers very, very little money. So let me just conclude by saying this. The United States of America is the wealthiest country on earth. We should have the best healthcare system in the world, not one of the worst. Given our purchasing power, we should be paying the lowest prices on earth for prescription drugs, not the highest. Instead of giving hundreds of billions of dollars in tax breaks to the richest people in this country, we should be proudly investing in coming up with cures for cancer, Alzheimer's disease, diabetes, and other terrible illnesses. That is what we should be doing. But I am afraid that in too many ways, we are doing exactly the opposite. Thank you, Mr. Chairman.